topic for today's discussion is health information system. The health information system is a basic tool of management and it provides the key input to any health system. Health information system is an integral part of any national health system. The health information system is a mechanism of collection of information, the processing of information, analysis, and finally transmission of the health informations. And all these processes, all these steps are required for organization of any health service as well as operation of any health service. It is also required for research and training purpose in health services. Now coming to the requirements of any health information system. So health information system should be population based, means it should able to solve any public health issue of any population, any community. The second requirement is that the health information should avoid the collection of the unnecessary data which are not able to provide any kind of important information in respect of health issues of community. This health information should be problem oriented, means the information about the health we are getting should solve any problem of community. This health information should be based on the frictional and operational terms of health issues. The health information should able to express, should able to briefly, precisely and immediately express the information with the help of the charts and graphs. And finally, the health information should able to provide a comprehensive and conclusive feedback in respect of any health issue. Now let's discuss about the components of health information system. So the first component is demography and vital statistics. This includes birth, death, marriage, migration. The second component is the environmental health states. As we know that few environmental factors are associated with the causation of few diseases. So in this we need to robustly monitor such environmental factors. The third component of health information system is health states, which includes morbidity, that is suffering or illness from any disease, mortality, that is death due to any disease, disability is inability to perform any disease, work because of those disease. It also affects the quality of life. The fourth component is the health resources, which in health information system we should also gather the information about the health facilities available, the beds available in that health facilities, and the health manpower available in those health facilities. The another component is the utilization and non-utilization of health services, means attendance of patients in any OPD or IPD of any health facility, the number of admissions, and the waiting list, the waiting time in any health facilities. Lastly, in health information system also includes the component, the financial component, which includes the cost as well as the expenditure. What is the cost of treatment in any health facility? What are the various expenditure in any health facilities? So there are 6 components of any health information system. So what are the uses of health information system? The health information system can be used to measure the health standards of any country, of any locality, and also to quantify the health problems or associated health problems present in any locality or any country. What are the various medical and healthcare needs of any country? It can also be used to for the comparison of the health standards in any locality, in any country, and as well as it can also be utilized for comparison of health standards internationally, means between the various countries. A health information can be used for planning, administration, and effective management of any health system of any country. It can also be used to check whether the existing health services are able to fulfill their objectives or not, means it can also assess the efficacy and efficiency of any health services. It can be also used to check the attitudes, to measure the degree of satisfaction of the beneficiaries utilizing any specific health system. And finally, the data from health information system can be used for further research and development in respect of particular problems of the health. Now let's see what are the sources of health information. So there are multiple sources of health information, which includes census, which happens in every 10 years, the registration of vital events, which comes under the Registration of Birth and Death Act. It also includes the sample registration system, the civil registration system, the National Family Health Survey, the notification of diseases, the hospital records, disease registers as well as the disease registries, record linkage system, epidemiological surveillances, and we can also use as health service records as sources of health information. As we already discussed that environmental health data can be also a fruitful source of any health information. The health manpower survey, population survey, and other routine statistics related to the health. And apart from that, the non-qualitative informations like policies, guidelines, which also include some kind of information, can also be a better source of any health information. In next video series, we will discuss about these various health information sources in details. Thanks for watching this video.